The Texas Medical Center in Houston is the largest medical center in the world. Each year, more than 5 million patients from around the globe visit its 43 member institutions. It's where many of the greatest advancements in medicine have been achieved. The Parkinson's Disease Center and Movement Disorders Clinic at Baylor College of Medicine is an excellent example of the expertise that characterizes the Texas Medical Center's prominence. Founded in 1977 by Dr. Joseph Jankovic, the center has evolved into an internationally recognized research, education, and clinical institute for patients with neurodegenerative and movement disorders. Recognized as a center of excellence by both the National Parkinson's Foundation and the Huntington Disease Society, the center has cared for nearly 20,000 patients, making its patient database the largest in the world and an invaluable resource of clinical information. Information key to unlocking answers to the debilitating movement disorders it treats, such as dystonia, tremors, Huntington's disease, Tourette's syndrome, and of course, Parkinson's disease. Although it is not yet known what causes Parkinson's disease, the center has been at the forefront of discovering how nerve cells are destroyed, and was the first to test many of the drugs used today in effectively treating the symptoms of Parkinson's disease and related disorders.
Every patient with Parkinson has different set of symptoms, different set of problems. So when we select therapy for Parkinson patients, we have to individualize the therapy and tailor it exactly to the needs of that particular patient.
The center's research has been instrumental in formulating a powerful arsenal of treatment options for patients with Parkinson's disease, where there was once very little to offer, and that is a valuable advantage for its patients.
You get to be on the cutting edge of the advances in the medicines and the techniques and whatnot, and that's all very useful.
A practicing attorney in Houston, Aubrey Calvin began treatment at the center when he was diagnosed with Parkinson's disease in 1983.
I like my work, and you got to be motivated to fight this thing. I just think that they have such a high level of expertise out there that it's really a national treasure.
Some of the center's most dramatic results have come from its surgical therapies. The Parkinson's Disease Center's Deep Brain Stimulation Program, a joint project of Baylor College of Medicine and the Methodist Hospital, is the most active DBS program in North America. The center's surgeons use the newest computer-controlled imaging technology available and the most advanced methods of interoperative brain recordings to implant a thin wire into the brain that is connected to a small electrical stimulator device they place in the patient's chest. When the device is turned on,
I'll start with this stimulator first.
An electrical impulse travels up the wire into the brain and blocks the tremors. The results of this innovative therapy are often nothing short of remarkable.
Well, I can't even put it into words. It's a miracle.
DBS has been so successful treating tremors in Parkinson's patients that the center's team now uses it to treat other neurological disorders. 14-year-old Brian Lemus has multiple sclerosis. For the last 3 years, Brian hasn't even been able to drink from a cup on his own.
Oh, okay. That's okay.
But since his DBS surgery, all that has changed.
To be able to see him just drink by himself, it's overjoying. And you can see brightness in his face. And this proud of, I can do it, Mom, I can do it.
The center's video lab has documented many other surgical results that have virtually transformed lives, including the well-known use of pallidotomies to relieve the severe muscle contractions of dystonia.
It's very rewarding to see patients who have improved as a result of medications or surgery, and it's very satisfying for me to see how the patients improve their quality of life.
Beyond therapies the center has formulated to effectively treat the symptoms of Parkinson's, its research is now at a threshold of discovery that may actually alter the course of the disease.
We have now medications that we believe may slow down the progression of disease. We call this neuroprotective therapy.
Protecting nerve cells and maintaining optimal productivity is especially important to patients diagnosed early in life with Parkinson's. The idea that Parkinson's disease only strikes the elderly is a misconception that has been corrected, in part, by the courageous public education efforts of its more famous patients.
The last couple of years, I've gone from talking to my agent on the cell phone to discussing cellular biology with great scientists like Dr. Jankovic and Dr. Appel.
Okay, next to your nose.
Eileen Bowman was 45 years old when she was diagnosed with Parkinson's disease. The mother of 5 young children, it just didn't seem possible that Parkinson's could be responsible for the shaking in her left hand.
When you first hear it, you think, oh my Lord, what am I going to do, you know? But you're going to be okay. You're going to make it. And I feel that way because of the clinic.
Good.
Eileen is taking a drug the center is testing to slow down the progression of the disease, while her family does all they can to support her at home. The same determination the center has brought to bear on Parkinson's disease has benefited its work with other movement disorders. Dr. Jankovic's pioneering use of botulinum toxin, or Botox, has revolutionized the treatment of at least 150 medical disorders. Jeannie Harrison drives more than 1,000 miles every 4 months to take advantage of his expertise.
I just wanted to find the best doctor in the United States, and I've heard that he's the best actually in the world.
Each year, Dr. Jankovic and his team are invited to present their innovative treatments, like botulinum toxin therapy, at scientific conferences around the world. In addition to more than 600 scientific articles, Dr. Jankovic has authored or co-edited many of today's most prestigious neurological textbooks, including those considered to be the Bible in teaching tomorrow's scientists and physicians.
One of the most rewarding aspects of my job is to train young physicians, young scientists, who then go on to become leaders in the field of Parkinson's disease and movement disorders.
Some of the highly accomplished physicians who have trained as fellows at the center have even become valuable members of its dedicated team. Whether the diagnosis is a movement disorder such as Huntington's disease or Tourette's syndrome, the center's staff provides more than medical expertise. It empowers the patients to reach their full potential.
They give you that hope. They know what you're going through, but also, I mean, they're there to hold your hand, but they're also there to lead you.
Hold your arms in front of you like this.
Okay. Hey.
When Tourette patient Michael Conway was inspired to begin a camp for children with Tourette's syndrome, the center staff supported his dream by volunteering as counselors and helping to distribute medications.
You're not just a patient. I mean, you're a person. And if you weren't a patient, they'd still be your friend.
Okay,
Good to see you, Dr. J.
The center's compassion and commitment has attracted the invaluable support of community leaders, dignitaries, and even its own patients in its quest for cures.
Without the support of dedicated philanthropists, we could not accomplish what we have accomplished. We've been very successful in obtaining funding from foundations and governmental agencies, but it is the support that we receive from these individuals that is so very meaningful to us, and I'm so grateful for it.
The support of these invaluable contributions also represents a supreme vote of confidence in the center's ability to deliver hope for tomorrow.
We are full of hope. There's so many things around the bend.